about deafness associated with old age, which we will all get eventually. Medically, it's called presbycusis, okay? And presbycusis usually means hearing loss in both ears. That's what's characteristic of it. So, old age deafness is called presbycusis. Shuknik described classically 4 types of presbycusis. The first type is called sensory presbycusis, and this is what the audiogram looks like. It's shaped like a reverse S, which makes it very easy to remember. Sensory presbycusis. In this type of presbycusis, there's a problem with the outer hair cells. We lose outer hair cells as we get older. And the speech discrimination in these patients are generally good. So that's sensory presbycusis in a nutshell. I'm going to talk about the other 3 presbycusis. Type of presbycusis is known as neural presbycusis, and in this type of presbycusis there is pathology associated with the nerve. So this is what the audiogram looks like. It's a straight line, a slanted line on both sides. Remember, it's symmetrical. The speech discrimination in neural presbycusis is generally poor because there's problem with the nerve carrying the signal from the ear to the brain. Okay, if you want to remember this easily, just think of an N, capital N, and this part of the N is the shape of neural presbycusis. The third type of presbycusis is called strial presbycusis. And here, the problem is with the metabolic exchange at stria vascularis level. And in this presbycusis, the pure-tone audiogram is essentially horizontal. Okay? The speech discrimination in this type of presbycusis is actually good. So the 4th type of presbycusis is known as cochlear conductive. And here the pathology is in the basement membrane. Remember, the cochlea is spiral. If the basement membrane is stiff and non-compliant in the apex of the cochlea, this is what the audiogram will look like. In this type of presbycusis, the speech discrimination is good. If the basement membrane is stiff in the base of the cochlea, this is what the audiogram will look like. The high frequency are affected, in contrast to the apex where the low frequency are affected. The basement, the speech discrimination in both types of cochlear conductive presbycusis is good. Okay?